Hey, hello everybody. Hi, I've just come on to share with you an experiential exercise. My name is Dr. Jo White. I'm a clinical psychologist and advanced certified schema therapist, and I admin this lovely group with Tana. And I've come to share an experiential exercise that I use in the assessment phase of schema therapy. It's an exercise that has been described by Laurel Parnell, who is an attachment-focused EMDR therapist. But this exercise is just as applicable to the assessment stage of schema therapy. So I hope you enjoy listening. It's going to be a brief 5-minute video today. So do pause a minute and listen. So this exercise is called calm place imagery with the adult and the vulnerable child. And it helps to really introduce the idea to clients about their vulnerable child mode and to assess the relationship between the child and the adult. So how does the child feel about the adult? And the adult and the child. Again, how does the adult feel about the child and meeting their needs? And it will also give you a sense of how strong the healthy adult is for your client. So I like to use this exercise early on in my schema therapy work during the assessment phase, but it's also a helpful exercise to use later on to check out how the relationship is developing between your client and their inner child, their vulnerable child mode. So, okay, the steps that you take for this exercise, it's quite simple and straightforward. But the first step is to guide your client to their calm place imagery. So I tend to describe it as calm or peaceful place, as I find that clients can struggle to identify a time when they felt safe. So I tend to use a calm place imagery. So guiding your client to engage with their calm place imagery. And if you haven't done that exercise with them, then you can do it at this point, helping your client to find somewhere that they feel calm or peaceful, really making the image as vivid as they can, enhancing the sensory details, so the sounds, the smells that they experience when they're there. So that's the first step, guiding the adult into their calm place imagery. And then the second step, you want to invite the child into the image. So inviting their child self into the image with them so that they join them in their calm place. And then first off, you want to talk to the child part within their calm place. So checking out with them how old they are, how they're feeling, what might be going on in their life at this point. So usually there's a reason why that age child has turned up in the calm place imagery. So exploring, what's going on in your life right now. Who are the important people? Maybe there's some experiences that are confusing or scary. So you can explore that as much as you like, really, going into as much depth as you like. I think it's a really nice way of getting a sense of what was going on for the child when they were little, for your client when they were little. So I like to explore that quite a lot. And then also at that point, checking out, how do you feel about the adult? So how does the child feel about their adult self? And from this question, you can get a sense of what might need to be done to repair the relationship between the adult and their vulnerable child mode, their little one. So I find that there's a real variety of responses that I get at this point. So sometimes the child might be saying, well, the adult just ignores me. They're not really aware of me. Maybe they feel abandoned. Maybe they feel like they're specifically being ignored. And then for some clients, actually find, the child is quite scared of the adult because maybe the adult does things that are specifically destructive towards the child because the adult's struggling with the way the child felt at those times or the way that they behaved when they were little. So getting a really good sense of how the child feels about the adult, and the steps that might need to be taken to help repair that relationship so that the child can trust the adult. And then the next step is talking to the adult. So how do they feel about the child? Why do they feel that way? What do they think about what the child has shared? What happened to the child at those times? And then thinking about, can they meet the needs of the child? Do they understand what the child's needs are? And what happens if they're to think about offering comfort or listening to the child or validating what's going on for them? So again, getting a real sense of how does the adult feel about the child, because sometimes it can vary as well. So you might expect that the child and the adult kind of feel similarly about each other, but actually often they don't. So it can give you a good sense of how the adult feels about the child, and again, the steps that might need to be taken to repair that relationship. And so then at that point, I will get clients to, take a few deep breaths and come back into the room with me. And then we'll spend some time debriefing about the exercise. So I'd ask questions like, how was that experience? What did they notice? What felt important or significant? And then we might reflect on that exercise and think about the steps that maybe need to be taken within our therapy work to get them to the place, to get them to their goals, thinking about our therapy objectives together, and helping them to understand that we're trying to develop that relationship between the adult and the child, that we're helping them to support the child's emotional needs. So it can be a really good way of introducing the inner child, the little child, to be worked with and supported and validated, and think about the work that needs to be done and the steps that need to be taken to develop that relationship. And that's the end of the exercise. So I hope you found that useful to hear about one of the exercises that I use in the assessment phase. I'd be really interested to know how you get on. Maybe some of you have tried that exercise already, and you've got some thoughts or experiences of how it's gone. In the comments below, please let me know how you get on with it. And I look forward to sharing another exercise with you on another day. All right, good to see you. Okay,